Welcome back, everybody, to another episode at Excelsior Orthodontics. My name is Dr. Minh here. Stay tuned as we look at gummy smiles, skeletal anchorage, and how can you correct it all without surgery. Stay tuned. All right, we have a wonderful article for you today from the Journal of Clinical Orthodontics right here. Let's take a look and dive right on in. But first, be sure to click the like button, subscribe to our channel if you want to learn more about orthodontics, all things related, whether it's clinical stuff, business related stuff, and how can we make your smile even better. All right, let's jump right in here. Treatment of accentuated gummy smile with skeletal anchored orthodontic intrusion by Dr. Marcel. Farret. So gummy smiles right here, vertical maxillary access. The main culprit is kind of like a little bit of a skeletal issue. A lot of times when people tend to have very, very strong, let's say like lip muscles, it tends to pull the upper lip really, really high. And it tends to show not just like the entire teeth of their smile, but even like gummy smile display. So teeth can be straight and everything. And the teeth may actually fit really, really nicely together. But the gummy smile kind of really can throw things off from like a total aesthetic standpoint. The main thing, the ideal way to look at it is when someone smiles, you actually want to see like maybe no more than like 1 to 2 millimeters of gummy, gingival gummy tissue above the tooth structure, particularly the upper lip. See right here, when I smile, it shows that the lips right here just fall right above where the teeth are at. So it fits real nicely. When we take a look here, in this particular case here, etiology factors include combination of maxillary vertical access, dentoalveolar protrusion, variable tooth proportions, access gingival displays, hyperactivity of upper lip in smiling. So the upper lip tends to really, really retract upwards. It's primarily related to vertical maxillary access, basically a lot of skeletal tissue that has led to like the downward growth of the maxilla. So this article here will actually utilize TADs, or temporary anchorage devices. These are basically tiny little screws that will go into various parts of their mouth. In there temporarily, just as a means of what we call anchorage, to actually pull the appliances in that direction. So in this case here, 32-year-old female, finished orthodontic treatment 3 years earlier. She had first premolars extracted, finished in full step class 2. Actually had really good bite, but the patient didn't like the gummy smile. She used Botox to help control the muscle activity, but still wasn't entirely satisfied. Asymmetric facial third, straight profile, excessive gummy display, 8 millimeters at the central and 10 millimeters at the molar. So she's actually more gummy in the back teeth than the front teeth. Spaces reopened at the extraction sites. Food would get stuck. All right, let's take a look here. Actually dive in nicely. Take a look at the pictures. Relatively straight profile. Pretty symmetrical for the most part. Really gummy, sure. Yeah, I mean, the upper lip tends to just really retract and like fold under. Kind of, not only is it gummy, but because of looks like a little bit of a transverse issue in the back, where it's really gummy on the back area, it tends to have like that omega shaped ever so slightly here. So it kind of exaggerates the posterior gummy smile more than typical. I mean, you can see here, it's beyond just straight teeth, people. A little bit of space cracked open. Teeth for the most part are straight. A little bit of crowding on the bottom, sure. Decent overbite, decent overjet. Looks pretty normal to me. The intercuspation, which just means the amount of articulation within these teeth here. Maybe the ceph may show a slightly deficient maxilla. Full step 2. The intercuspation is good. That's not the main issue. Patient's chief complaint treatment objectives were to reduce the gummy smile through upper dental intrusion, expand the upper arch, and thus reduce the buccal corridors. Procline the upper lower incisors to reduce the overbite and close the space in the upper arch. So basically, their plan is to expand this upper arch, kind of get rid of this little bit of slight omega shape here, get rid of this crowding, close the spaces. She has a slight deep bite, so you want to procline those upper lower incisors, which basically just means you want to angle out the top and bottom teeth slightly forward. So right here in this picture, they put metal plates at this little bony area just between your first molar and second molar. Placed here, and put some mini screws between the lateral incisors and canines right in this bony area here. And it's all around. They progress into a bigger enough wire, and they throw in some coils here. No, they threw in some power chains here. They started with 150 grams of force in the anterior, 200 grams of force in the posterior. A month later, force was increased to 350 grams of force, 500 grams of force in the posterior. So not only are they using these power chains here to pull the upper arch upwards or intrude, they're actually also using elastics, or they call end elastics here, to pull the lower teeth upwards. So it's not, so that's why our lower teeth are just going to follow the traction of the upper teeth, follow it the whole time. So you see it's tracking upwards. It looks like they're, if you just count the number of links, you can tell they're making progress here. Space in between them, and then down to 3 links with space. So maybe 3 links with no space in between them, followed by more. Looks like maybe 3 links and no space between them. Huge change in her smile right there. This is all without surgery. This is great. Beautiful. She's thrilled with this. Absolutely. Still has nice intercuspation of the teeth. A little bit. Could be a little bit wider. Maybe right there just a little bit. After 10 months in intrusion. Wow. Look at this beautiful result. Look at the expansion alone of how wide her arch is from before here in this more of an omega shape here to after here. Much broader. All spaces are closed. Look at the smile difference. Super gummy, huge buccal corridors to really nice broad, yet still not like overly broad. Very natural looking width of her smile. This looks great. And look at this. Even like the lips look normal, just like before. And about 2 millimeters maybe in some areas, 3 millimeters in the back of showing of the gummy smile. This is beautiful. Treatment results: remarkable reduction in the gingival display and buccal corridors. The profile was virtually unchanged except for a slight increase in chin projection. Analysis of intraoral and dental scans revealed good intercuspation both sides in class 1. Adequate. Overjet and overbite remain. Roots were perfectly parallel. It improved the gummy smile even more. So after intruding the upper teeth, like going upwards, and then they pull the lower teeth upwards, removed everything, even though there's still a little bit of gum tissue that they had, you use a little bit gingival contouring from the specialist to remove that extra tissue. Just that little extra touch of detail. What a beautiful result. She's absolutely thrilled with this gummy display. Wow. Using mini screws. Kind of lock that down. Full 26 months of time frame. It's beautiful. Transverse issue. Could be a little wider. A little deep. Yeah, the teeth were straight. See, this is another example. It is not just about straight teeth, people. How does a full smile like come into play? Like the entire arch. How do you smile? That's ultimately what the real goal is. It's not just straight teeth. Straight teeth is a part of it. We want to make sure that the teeth fit together really, really well, which it did. But also, how does it look in the overall smile of everything? Align yourself with a really good team, whether it's orthodontist, general dentist, oral surgeon. Make sure we're all on the same page to accomplish your smile. Beautiful result. Great job. Thank you very much to the Journal of Clinical Orthodontics for sharing this article. I'll look forward to sharing more with some of this stuff with you guys soon. Be sure to click the like button, subscribe. It was wonderful, people. I'll see you guys soon. Bye, guys.